Welcome back. This is part 51 of things that your vet staff wishes that you knew, and we are still covering dachshunds right now, but specifically all of the health conditions that they are prone to. And if you haven't already, I do recommend you going back to watch part 50 where I cover all the basics. And just because I can, here are my three wieners again. Jasper's my oldest on the left, Minnie's in the middle, and Mickey is on the right. As I mentioned at the end of the last video, this is not a low maintenance breed. They do come with some significant health risks that we're going to talk about. One of the number one things that we worry about in dachshunds is IVDD, or intervertebral disc disease. And I did an entire video on this in more depth back in part 30 if you want to go watch that. Because they have such long backs, the discs in their back are more prone to degeneration and herniation, and this can cause a lot of pain, trouble walking, and even paralysis in severe cases. Because they are a small breed dog, they are more prone to dental disease and luxating patellas, and both of those I have done previous videos on if you would like more detail. Dental disease was back in part 15, and luxating patella was in part 32. Dachshunds also tend to be very food motivated and are prone to obesity because of it, so you do have to watch how much you allow them to eat. They can also be prone to some eye issues like progressive retinal atrophy, which can lead to a gradual blindness, as well as things like cataracts and dry eye. Another condition they can be prone to is Lafora disease, which is a type of epilepsy that is commonly seen in dachshunds, especially long-haired ones, and it can cause muscle twitching or seizures, often triggered by things like flashing lights and sudden noises. Dachshunds can be prone to Cushing's disease, which is a hormonal condition that causes things like increased drinking and urination, a pot-bellied appearance, and hair loss. And the last major health concern I will mention for this video is hypothyroidism. It can lead to weight gain, low energy, and skin or coat changes. And finally, that is all I'm going to cover for dachshunds. So let me know if you have any questions or suggestions on what else you want me to cover. Love you guys, bye. Welcome back. This is part 52 of things that your vet staff wishes you knew. And for this video, we're going to talk about UTIs, or urinary tract infections. First things first, a UTI is a bacterial infection of the urinary tract, most commonly the bladder. Not every pet that's having trouble peeing actually has a UTI. What they do have is what we call lower urinary tract signs, and multiple things can cause those. Lower urinary tract signs are symptoms related to the urethra and the bladder, not a specific diagnosis. Conditions that can cause lower urinary tract signs include bacterial UTIs, sterile cystitis, crystals in the urine, bladder stones, urethral plugs or obstruction, masses or tumors, and even things like anatomy issues or incontinence problems. So what signs should you look out for? Signs include peeing more frequently, straining or taking a long time to pee, only producing small amounts of urine at a time, blood in the urine, accidents in the house or outside the litter box, licking at the area, and sometimes even vocalizing or acting painful. Dogs, especially females, are more likely to get true bacterial UTIs, and that is because they have the shorter and fatter urethras, making it much easier for bacteria to reach the bladder. In cats, we often see cystitis, crystals or stones, or urinary blockages causing these symptoms, but true bacterial UTIs are not impossible. When we see these symptoms, we more often than not are going to recommend running a urinalysis, and the urine can be collected either by free catch or by a cystitis, which is when we use an ultrasound to locate the bladder and poke it directly with a needle. When we do that, we have less environmental bacteria that might be muddying up the picture. It's more accurate as to what is inside the bladder. In some cases, we might also recommend sending off a urine culture, which is when we see what grows from the urine. It can take a little bit longer to get those results, but then you find out exactly what organisms are present and can know exactly how to kill them. If your pet starts getting recurrent UTIs, we usually need to investigate a little bit further to figure out what the underlying cause is. That can be anything from hormonal changes, bladder stones, anatomy problems, or other underlying conditions. And just a little reminder, we probably will not prescribe antibiotics unless we are concerned that there is a bacterial component or have proof that there is one, because it won't help for a lot of the other potential causes. That's all I'm going to cover for this video, so let me know if you have any questions or suggestions on what else you want me to cover. Love you guys, bye. Welcome back. This is part 53 of things that your vet staff wishes you knew, and for this video we are going to talk about cystitis. The term cystitis means bladder inflammation, but it doesn't always mean infection. Let me elaborate on that. Almost every time a dog or a cat has a urinary tract infection, they are going to have cystitis or bladder inflammation. But the bladder inflammation can also happen by itself without a bacterial presence. We more often than not will see cystitis without a UTI in a cat more than a dog. If you haven't already, I do recommend you go back to watch part 52 where I did a whole video on urinary tract infections, because I did lay a lot of the groundwork that I'm going to refer to in this video. In the last video, I did cover lower urinary tract signs, which are the signs and symptoms that we look out for that tell us something is going on with the urethra and the bladder. I also explained that this is why getting a urinalysis done when your pet is exhibiting symptoms is important, because bacteria is not always the cause. In cats, we can see something called FIC, or feline idiopathic cystitis. Idiopathic meaning we can't really pinpoint one clear cause. And FIC can be triggered by stress, and sometimes it's something that seems so small, like your cat not liking their new litter box, that can trigger it. Other than FIC, cystitis in cats can be caused by stones, crystals, inflammation, and sometimes infection. And although I did cover this back in part 12 for cat emergencies, I'm going to bring it up again since we are talking about urinary issues. It's not impossible in females, but especially in male cats, they have the potential to get blocked. This is an emergency when it happens. And since the symptoms of a urinary blockage can sometimes look really similar to other issues, this is why you do not want to wait to get help. Treatment for cystitis may not always look the same. It really depends on what we're suspecting the initial cause was. If it was a bacterial infection, probably antibiotics. If it was crystals or stones, maybe changing the diet, increasing the water intake, or some involved procedures or even surgery in some cases. If it was truly idiopathic, we're going to focus more on the environment and keeping their pain under control. And the last thing I'm really quickly going to mention is not going to guarantee that your cat will never suffer from cystitis, but could decrease the chances. A good rule of thumb is to have one more litter box than you do cats in the home. If you have 4 cats, you should have 5 litter boxes. And that's everything I wanted to cover for this video, so let me know if you have any questions or suggestions on what else you want me to cover. Love you guys, bye. Welcome back. This is part 54 of things that your vet staff wishes you knew, and for this video we are going to talk about Doberman Pinschers. Dobermans come in 4 main recognized coat colors: black, blue, red, and fawn. Any other color that is considered rare or exotic is likely going to be prone to more significant health issues than the breed is already predisposed to. Dobermans were created in the late 1800s by a German tax collector named Louis Doberman. His goal was to create a loyal, protective, and intimidating dog that would guard him while collecting money. Dobermans tend to be extremely bonded to their owners, highly intelligent, have some high energy levels, and are naturally protective. They're amazing dogs, but as with any breed, they come with their own set of health concerns that you should be aware of, and we're going to cover some of the biggest ones in this video. One of the biggest things you need to look out for if you have a Doberman is something called DCM, or dilated cardiomyopathy. It is when the heart becomes enlarged and weak and then can't pump effectively. Signs can include lethargy, coughing, collapse, or even sudden death, because unfortunately DCM is one of those silent until it's not diseases. Another thing they can be prone to is something called von Willebrand disease, and that is a genetic clotting disorder that can cause excessive bleeding from things like nail trims, surgeries, and injuries. And many dogs with this live mostly normal lives. You just need to know before you go into surgery. Dobermans can be prone to wobbler syndrome, and in simple terms, that's basically compression of the spinal cord in the neck. And signs can include a wobbly gait, especially in the hind limbs, weakness, and neck pain. They can also be prone to hip dysplasia, and I did an entire video on this back in part 31 if you would like to go watch that for more detail. Dobermans can be prone to hypothyroidism, which is an underactive thyroid, and it can cause things like weight gain, lethargy, hair thinning, and poor coat. And the last major health concern I'm going to cover for this video is GDV, gastric dilatation volvulus, or bloat. It is when the stomach fills with gas, twists on itself, and cuts off blood flow to the rest of the GI tract. This is an emergency when it happens. You do not want to wait to get help. Signs can include a distended abdomen, retching without anything coming up, restlessness, or even collapse. I think I have just enough time for a quick mention on something controversial. The cropped ears. Dobermans do not naturally come with their ears upright like that. That is a surgery that they do to make them stand up. It is a cosmetic procedure. There is no medical necessity for it. So you will actually find a lot of vets will not perform the surgery. But that is everything I'm going to cover on Dobermans. So let me know if you have any questions or suggestions on what else you want me to cover. Love you guys, bye. Welcome back. This is part 55 of things that your vet staff wishes you knew. And for this video, we are going to cover Jack Russell Terriers and things you should know if you have one or plan on getting one. As usual, we're going to start with a picture and talking about coat colors and types. They come in 3 different coat types: smooth, like the one in the picture, rough, which has the more wire hair, or broken, which is a mix of the two. And for colors, they typically come in white and tan, black and white, or tricolor with white, black, and tan. But the one key thing that should stay the same between all dogs of this breed is they should be predominantly white, and that is because of what they were bred for. They were bred to hunt foxes, specifically chasing them into their burrows and attempting to flush them out. And hunters needed to be able to tell the difference between their dog and a fox, hence the white coat. So let me just reiterate, this is not just a lap dog. They are working dogs. They have a tendency to have some high energy, they're very intelligent, they have a strong prey drive, they're very vocal, and can be very bold and fearless. In general, these are very hardy dogs. They do still have some health concerns that I'm going to cover, but nothing compared to some of the other breed videos that I've done before. Because they are a small breed dog, they are prone to luxating patellas and dental disease, and I've covered both of those in more detail in previous videos. Dental disease was back in part 15, and luxating patella was back in part 32. They can also be more prone to having eye problems, including cataracts, progressive retinal atrophy, and something called primary lens luxation. Primary lens luxation is when the lens inside the eye breaks loose from its normal position, and it can very quickly lead to secondary glaucoma and blindness if it's not treated quickly. This is considered an emergency, and you should get help as soon as possible. Although it is rare, probably the most significant health concern that they are prone to is something called spinocerebellar ataxia. It is a genetic neurological disease that is seen in many different terrier lines that causes balance and coordination issues. Early signs of it can look like slightly wobbling, clumsiness, and trouble with coordination, but as it progresses, you will likely see more of a wide stance because they're trying to balance themselves, stumbling or crossing their legs, head tremors, or difficulty jumping and navigating. And the last health concern I'm going to include for this video is something I would like to call they will hurt themselves syndrome. And I'm only half joking whenever I say that. Because of that high prey drive and having zero fear, they are more prone to injuring themselves. Some examples would be getting hit by a car, injury from jumping, picking fights with other dogs, perennial ulcers, and overexertion because they do not seem to have an off button. These can be phenomenal dogs to own. You just have to keep an eye out for the potential health concerns and do your absolute best to keep them from hurting themselves. That's it for this video, so let me know if you have any questions or suggestions. Love you guys, bye. Welcome back. This is part 56 of things that your vet staff wishes you knew, and for this video we are going to talk about FIV, or feline immunodeficiency virus. The biggest thing I want you to take away from this video is FIV is not a death sentence, nor can your cat give you FIV. FIV is a virus that affects the immune system over time, which means these cats can be more prone to infections, but many of them live for years with a good quality of life despite it. It is spread through saliva, primarily deep bite wounds. Shared bowls and transmission from mother to kitten could also happen, but it's not as likely since the virus doesn't survive very long in the environment. So that means that just because you have one FIV positive cat doesn't mean you can't have other cats in the household. Instead of causing one specific set of symptoms, FIV weakens the immune system, so we tend to see secondary issues like chronic dental disease, skin infection, upper respiratory infections, or just a cat that isn't thriving like we would expect. Some cats look completely normal for years before anything shows up. In times of stress, it can be more likely to flare up. This is because an increase in cortisol levels further weaken the immune system. Testing can also be a little bit tricky because most tests are looking for antibodies, not the virus itself, which means that things like recent exposure or maternal antibodies in kittens can affect results, so sometimes we need follow-up testing to confirm. Ideally, an FIV positive cat should be kept indoors, kept up to date on care, and monitored closely so we can treat any issues early. The goal is prevention and early intervention. There used to be a vaccine for this, but it is no longer regularly used in North America. That is partially because it wasn't super effective at preventing all strains of FIV, and also because it could mess with testing and cause a false positive. Because as I mentioned before, most tests are looking for antibodies, and vaccines cause antibodies. FIV can sound scary, but it's usually the misinformation that makes it sound far scarier than it actually is. These cats are still very worthy of homes, love, and a full life. And the last point I want to make before I wrap this video up is that the cats that you find, the stray cats on the street, are more likely to have this because of cat fights. So if you do decide to take in a stray cat into your home, it is important to get this testing done early so that you know what you're up against if they do have it, and you can keep an eye out for any of those infections that might appear. But that is all I'm going to cover for this video, so let me know if you have any questions or suggestions on what else you want me to cover. Love you guys, bye. Welcome back. This is part 57 of things that your vet staff wishes you knew, and for this video we are going to talk about URIs, or upper respiratory infections. URIs in pets is similar to what a cold would be for humans, but it can definitely have some more serious consequences. This is especially true in cats because cats rely very heavily on their smell in order to eat. So if they can't smell because their nose is all blocked up, they're likely to stop eating, and that can get very dangerous very fast. URIs in both cats and dogs are usually caused by a virus, but once that virus has already settled in there, it leaves the lungs more susceptible to a secondary bacterial infection on top of it. There's also the risk of pneumonia in severe cases or cases left untreated. In cats, URIs are usually caused by viruses like herpes virus and calcivirus. Herpes virus is especially important here because it actually stays in the body for life and can flare during times of stress. And another honorable mention, although it does not actively cause infection, just leaves them more susceptible to it, is FIV. And I covered this in the last video in part 56. In dogs, what we often call kennel cough is actually a respiratory complex, meaning it's caused by a mix of viruses like parainfluenza and influenza, as well as bacteria like Bordetella that can be a little bit more opportunistic and cause a secondary infection. Both cats and dogs can show both upper and lower respiratory signs, but we will often see cats with more of the upper respiratory signs and dogs with more of the lower respiratory signs, since kennel cough primarily affects the trachea and the bronchi. Let's quickly talk about the difference between the upper and the lower respiratory signs. So upper respiratory signs would primarily affect the sinuses, nose, throat, and eyes. And signs would include sneezing, nasal discharge, eye discharge, congestion, and decreased appetite, especially in cats. Lower respiratory signs would primarily affect the trachea, bronchi, and lungs, and signs would include coughing, gagging or retching, and sometimes even throwing up because they have so much force behind it, increased respiratory rate, labored breathing, and exercise intolerance. Vaccines can help prevent, or at the very least lessen, the severity of the case that your pet gets. So unfortunately, vaccines are not foolproof, but they do provide protection and ability to help fight things off when they do happen. It's the same concept as humans when we get our flu vaccine yearly, and it still doesn't guarantee that we won't get it, but it does give us a better fighting chance. And the last point I want to make for this video is that we will not always use antibiotics. Antibiotics will not help a viral infection. They will only help if we're suspecting a secondary bacterial infection. That's everything I wanted to cover for this video, so let me know if you have any questions or suggestions on what else you want me to cover. Love you guys, bye. Welcome back. This is part 58 of things that your vet staff wishes you knew. And for this video, we are going to talk about the Bernese mountain dog and things you should know if you have one or plan on getting one. As usual, we are going to start with a picture and talking about coat types and colors. So Bernese mountain dogs will always come with a thick double coat, and are always tricolor with the black, tan, and white. Every other breed I have covered so far has come with at least one other coat color that is standard for them, but that is not the case for the Bernese Mountain Dog. They only come in that tricolor coat pattern. Bernese Mountain Dogs come from Switzerland, specifically the Swiss Alps, and they were bred for pulling carts, driving cattle, and guarding property. They tend to be affectionate and loyal, very people-oriented, great with kids when properly socialized, and typically very friendly. They are, unfortunately, relatively short-lived, between 6 to 10 years on average, and we have some significant health conditions to cover here. First and foremost, let's knock out that coat. That coat puts them more at risk for skin and ear issues. It is very thick, it can trap moisture. That causes problems over time if they're not maintained. Another worthy mention with that coat is heat exhaustion or heat stroke. They are not meant for hot weather for long periods of time. Because they are a deep-chested breed, they are more prone to GDV, gastric dilatation volvulus, and I have touched on this in a few other videos, but this is an emergency when it happens. It is when the stomach flips on itself, cutting off blood supply to the rest of the GI tract. This breed is also prone to a number of orthopedic issues, including elbow dysplasia, which I plan to cover in a future video, hip dysplasia, which I covered in part 31, CCL tears, which I covered in part 33, and early onset arthritis, and I covered arthritis back in part 29. Bernese Mountain Dogs are also very prone to having cancer. This is actually the #1 cause of death in Bernese Mountain Dogs, so that could include histiocytic sarcoma, the most common in this breed, lymphoma, mast cell tumors, osteosarcoma, and others. I have 3 more health conditions I want to mention for this breed before I wrap this up, but I need to be pretty quick about it because I'm running low on time. The first one is subaortic stenosis, which causes heart murmurs, exercise intolerance, or even sudden death. The second one is degenerative myelopathy, which causes progressive hind limb paralysis, similar to ALS in humans. And the last one is progressive retinal atrophy, which causes progressive blindness. I do plan to go into more detail on some of those conditions in future videos, but for the time being, this is everything I wanted to cover on Bernese Mountain Dogs, so let me know if you have any questions or suggestions. Love you guys, bye. Welcome back, this is part 59 of things that your vet staff wishes you knew, and for this video we are going to talk about miniature American Shepherds and things you should know if you have one or plan on getting one. Let's start with a picture of one and talking about coat types and colors. So they will always have a medium coat with a double coat underneath, and they come with a straight or slightly wavy coat. They usually come in blue merle, red merle, black or red with combinations of white markings and copper or tan points. This breed does have the merle gene naturally occurring in them, but you do not want to see breeders that are doing double merles. We will cover that more in a future video. Miniature American Shepherds were derived from smaller lines of Australian Shepherds in the US until it became its own breed. I do think it's important to mention here that many Aussies are not a standard breed, so oftentimes you actually have a miniature American Shepherd, or you really do have a smaller Australian Shepherd, but that usually comes from things like backyard breeding and runs the risk of some bad temperament and some more health concerns. Miniature American Shepherds were bred to be compact herding dogs used for livestock work like sheep and goats, so they are still a working breed. They tend to be highly intelligent, have some high energy, can be very trainable, they can be anxious or neurotic if they're understimulated, and they can be reactive or wary of strangers if they're not properly socialized. Now let's talk about the health conditions that they can be prone to. First, this breed is more at risk for being obese, especially if they are under-exercised. They have more risk of dental crowding and dental disease, which I covered back in part 15. They have a couple different orthopedic issues they are also prone to. Hip dysplasia, which I covered back in part 31, elbow dysplasia, which I will make a future video on, and luxating patella that I covered back in part 32. Because they are a herding breed, they are also more prone to having epilepsy. They can also be prone to having some eye issues, and that can include cataracts, progressive retinal atrophy, which causes progressive blindness, or something called Collie eye anomaly, which is very common in herding breeds. Collie eye anomaly is congenital and it can be tested for, and it also has a very wide range of severity, from the dog looking and acting normal and having mostly normal vision to retinal detachment, bleeding in the eye, and vision impairment or blindness. And the last health condition I'm going to cover for the purpose of this video is the MDR1 gene mutation. The MDR1 gene controls a protein that acts like a filter at the blood-brain barrier. When it's defective, certain drugs can cross into the brain and become toxic. It can be tested for, and responsible breeders should be screening for this. But that's everything I'm going to cover on this breed, so let me know if you have any questions or suggestions on what else you want me to cover. Love you guys, bye. Welcome back. This is part 60 of things that your vet staff wishes you knew, and for this video we are going to talk about blood work. Blood work is one of the most important tools that we have in vet med because it gives us a look at what's going on inside your pet's body, things that we wouldn't be able to tell on a physical exam and things that might not even be showing symptoms yet. There's a lot we can learn from your pet's blood work, and we're going to talk about a few of them in this video. One of the values we will look at is red blood cells, and we'll also look at hemoglobin and hematocrit to give us more information about that red blood cell value. Hemoglobin is a protein in the blood that helps it carry the oxygen, and hematocrit is the value that tells you what percentage of that tube of blood that we took is actually red blood cells. If red blood cells, hemoglobin, and hematocrit are all low, we are looking at anemia in some form. And that is usually for one of three reasons. The first reason is going to seem relatively obvious, but losing blood. That could be bleeding externally or internally, or some parasites can cause this, but the body is losing red blood cells faster than it can replace them. The second reason is a decrease in production, so that could come from things like chronic illness or inflammation, bone marrow disease, including cancer, chronic kidney disease, or some medications and toxins, but basically the bone marrow is not able to keep up with the body's demands. And the third reason is destroying red blood cells, so the body is destroying its own red blood cells, and you might see this in things like immune-mediated hemolytic anemia, some tick-borne diseases, some toxins and medications, or infections that are involving the red blood cells. Another value we look at on blood work is platelets, and platelets are what help your pet's blood clot, so their main job is to stop bleeding and blood loss. If platelets are low, that is called thrombocytopenia, and that can lead to things like bruising, bleeding gums, or even internal bleeding in severe cases. This could happen if the body is destroying platelets, like with immune-mediated disease or some tick-borne illnesses, if the body isn't making enough in the bone marrow, or if they are being used up in things like severe bleeding or illness. It's important to know that sometimes platelets can look falsely low on a machine, and that is because they can clump together, especially in cats, so we might want to double check that value on a microscope. If platelets are high, that is called thrombocytosis, and it usually means that the body is recovering from or attempting to fight off things like inflammation, infection, illness, chronic disease, or injury. And while high platelet counts are not quite as immediately concerning as low platelet counts, it is something you should keep an eye on. It's usually signifying something else is going on, and trends do matter here. I'm running low on time, and because I want to do everything that I want to cover justice, I'm going to break this up into a couple different parts. So I will stop this video here as part 1 of blood work, and I'll see you in the next one. Let me know if you have any questions or suggestions. Love you guys, bye.